Cardiology in Turkey. Why do foreigners with heart diseases come to this country for treatment? How are Turkish cardiology clinics equipped? And who are Turkish cardiac surgeons in the eyes of the world? This is what our video today is about. We will visit a specialized cardiac center in Antalya, Turkey. We are going to see the wards and operating rooms, and we will meet a doctor who treats patients from other countries. Subscribe to our channel where you'll find many informative videos about medical tourism in Turkey. Cardiovascular diseases rank first in the statistics of causes of mortality. Heart diseases contribute to 16% of global deaths, making them a significant worldwide cause of fatality. In developed countries in Europe and America, this figure is only 1% lower, despite all the advances in modern medicine, and not everyone can benefit from them in these countries. Treatment in Turkey has unique advantages in this regard. Turkish doctors have all imaginable medical devices and technologies at their disposal. Their education and experience allow them to perform the most complex operations, and the cost of treatment in Turkish hospitals is much lower than in Europe and America. That's why many people travel to Turkey for medical treatment. Foreign patients like to go to Turkey because the costs of medical services here are low, and scheduling treatment here is fast and straightforward. And the outcomes are exceptionally good. Once I performed surgery on a patient from Norway. A year later, he flew back for a checkup, and I was astonished that he came just for that purpose. I thought he could have easily consulted a cardiac surgeon in Norway, but this patient told me that at home, he was unable to reach a cardiologist and schedule an appointment. Maybe there are few cardiologists in Norway, or people don't want to be doctors there, I don't know. The healthcare system there does not allow people to easily get appointments, and patients do not always receive actual help. Moreover, it is an expensive pleasure there. So, imagine, the patient flew here from Norway just for a medical examination. Most often, patients from abroad come to us with complicated cases, such as surgeries that cannot be performed elsewhere. Often, procedures that doctors in other countries want to perform through open surgery, we conduct here using closed methods, that is, minimally invasive techniques or even interventional methods without surgical operations. The fact that minimally invasive techniques are a primary preference of Turkish surgeons, their hallmark, is now known worldwide. Turkish doctors consistently choose minimally invasive procedures over traditional open surgery when confronted with the option of using probes and catheters instead of making large incisions. After minimally invasive surgeries, there are fewer scars, less damage to internal organs and skin tissues, the risk of post-operative complications is reduced, and the body's recovery process happens more quickly. For visualization and control during surgeries, Turkish clinics use the most precise and modern equipment available. This is our angiography complex called Philips Azurion 5. Using this device in our hospital, we are able to perform all types of cardiological, cardiovascular surgeries and electrophysiology studies and operations here. On the screen right now, you can observe the image of coronary angiography. When doctors examine the vessels and coronary arteries through angiography, they see such a detailed and clear picture. We place the patient on this examination table and clearly observe the area of interest using an X-ray scanner. We can view the area from any angle, and it instantly displays the entire picture on a large screen for us. This system has a multitude of other functions. We can perform CT scans, and we can also do coronary angiography. We have a DS mode, which we specifically use for visualizing the vessels in the brain. The equipment in Turkish hospitals and the education of doctors make it possible to perform operations that are rarely available in many other countries. For instance, a few doctors in Turkey perform non-invasive transcatheter aortic valve implantation procedures. The new valve is delivered to the heart through a large blood vessel, such as the femoral vein. A special flexible catheter is utilized for this purpose. No large stitches remain. The patient's rehabilitation after such an operation takes only 3 days. A special video about this method can be watched through this link on the screen. These surgeries are considered almost exclusive worldwide, but in Turkey, they have long been available. At the moment, I am one of those who perform the most TAVI operations in the world. I am an instructor and a practicing surgeon doctor for several medical companies. There are patients in other countries for whom I perform surgeries, so I operate not only in Turkey. Sometimes people ask me if I can come with my team to perform a surgery, and I often say yes. At the same time, good Turkish doctors do not make empty promises or claim that their treatment is superior. Do Turkish cardiologists have at their disposal some special, perhaps the most advanced methods that many cardiologists in other countries around the world do not yet possess? I cannot say that the treatment methods in Turkey are truly unique, as we generally follow European and American guidelines and their developments very closely. We perform complex procedures done in a minimally invasive way, such as aortic valve implantation, valve replacement through the femoral vein, aortic valve repair, mitral valve repair, and many other cardiovascular surgeries and interventions. Some ablations and interventions that do not require open heart surgery for structural heart diseases are performed here, are often performed in our country, and our clinic is one of those capable of doing them. To avoid mistakes when choosing the right cardiology clinic and doctor, the patient should consult independent medical professionals. In Turkey, this can be done for free at a special medical service company. Its staff members are practicing doctors with diplomas and experience in Turkish clinics, so they understand the specifics of this field.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkiye, select the best clinic and doctors for him based on the diagnosis, preferences, and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly, and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
Diagnosis is carried out step by step. Our first step is a conversation, or rather, a consultation with the doctor, where we take the patient's medical history, then a physical examination, then an ECG, then a stress ECG or treadmill test. Then myocardial scintigraphy follows, where a radioactive substance with a short half-life is injected into the body, and by observing its distribution density in the heart, we are able to make predictions about potential vessel blockage. The next step is CT angiography of the heart's internal vessels, and of course the gold standard is coronary angiography. 10 years ago, gaining access to angiographic laboratories was somewhat more difficult, but nowadays they have become very widespread and common in our country. Therefore, many interventional procedures can be performed using minimally invasive methods. These methods can be utilized in numerous clinics. Having enough experience, I can say that in the last 10 years, we have made significant progress in this area. We can already see that heart disease mortality in Turkey has significantly decreased compared to other countries. Thanks to Turkey's strong dedication to providing quality healthcare and its remarkable progress in the field of medical tourism, individuals from abroad now have easy access to cutting-edge cardiovascular treatments. Patients, we constantly make special videos about specific operations and treatment methods on our channel. Here is the link to a playlist on cardiology and cardiovascular diseases. Additionally, we have playlists dedicated to various other medical fields and specialties: oncology, obesity treatment, gynecology, plastic surgery, and many other types of medical care where Turkish doctors excel. For consultation, you can contact us at this phone number or through the chat on the company's website. The website address is on your screen. Also, there is a lot of information on other areas of health tourism too. Another source of knowledge about medical tourism in Turkey is the Instagram account of the Healthy Turkiye. You can subscribe using this QR code or the link in the description. If you liked today's video, please hit the like button and subscribe to us for new videos about medical tourism in Turkey.